Well, despite a tremendous effort to stop it by conservative lawmakers, the American Affordable Health Care Act, often referred to as Obamacare, began phasing into American life. It makes insurance available for more than 12 million people who currently don't have any insurance, but it's not cheap and it has not been completely smooth. Joining us now to talk about it is Aaron Smith, who is a small business consultant at his own firm, A.W. Smith Financial Group. Aaron, thank you for joining us.
Thank you, Gary. Glad to be here.
So let's get right to it. The new marketplace for buying health insurance opened up today. What has been the overall reaction?
Well, first of all, Gary, we have 50 million individuals in this company who currently don't have health insurance. And over the last many decades that we can remember, the cost of health care has gone up even more rapidly than inflation. That being said, the Affordable Health Care Act is here. And the reaction has been, we just don't know. It's a question mark right now. Gary had myself and a few of my staff members go on to healthcare.gov today and do a little bit of research, see if we could actually get on and put our information in. And it's been a little bit of a challenge today, I would say the least.
Now, a lot has been made of this so-called healthcare exchange. What is exactly, can you walk us through, if there's such a simple walkthrough, as to what people who do not have health insurance have to do in order to find a plan that fits them and their families?
Right, excellent. Thanks, Gary. Good question. Here, look, the healthcare exchange is akin to hotwire.com, for example, if you wanted to go out and shop for a hotel. What it's designed to do for individuals, Gary, who don't currently have health insurance, they can go out and they can shop on this portal. And this portal is generally through your website. It's online. It's through healthcare.gov. And you basically go in and you put in simple information that it's designed to ask you. And you can then shop for the type of insurance that you're looking for yourself. You can compare plans. There are multiple different plans that are there to help you make a great decision about what's important as it relates to healthcare to you. So at the end of the day, if you take some time out, you go online, you do a little bit of research before you go on, you'll find yourself in a situation where you'll find that it's not really that challenging to get this done.
A lot has been also spoken about this $95 penalty, or a penalty in general. It depends on the range. Do you expect people to actually take the penalty rather than take part in the exchange and sign up for health insurance?
Well, I think what will happen here, Gary, is for those individuals who are above means, I should say, have really good salaries, really good income, you would suspect that those people probably would take the penalty. But look here, those people probably already have health insurance, Gary, already anyhow. Those individuals who don't have health care, those are going to be those individuals who are challenged. Maybe they've lost a job. They may be at a different level in terms of their economic situation. And I would suspect that those penalties are going to come for those individuals who don't join. But I would think that they will have to pay. And this is how they're going to pay. It's not going to be a check that you're going to write to the federal government, Gary. It's actually going to be deducted as a tax penalty to you. And it's going to be directly done through your taxes. So you're going to have to pay it. There's not going to be any way around it if you incur this penalty.
Now, some of the demographics that jump out really early in terms of people who would take part in this, obviously somebody who is married, people who have families. But when you're 25 years old, you generally think you're going to live forever. Do you have any data on whether or not young people will be taking advantage of this the registration or the sign-up in the coming days or weeks?
Well, I tell you, Gary, it's interesting. I have a group of employees here, and the employees who were more interested in going on to this site today and taking advantage of this opportunity were actually my employees who were younger. They were the younger group. They were actually under 30 years old. I find that pretty interesting. I think young people who, as you said before, feel that we are immortal, for example, we're not going to need care at some point, no time in the future, are starting to pay attention. Maybe the message is getting across. Let's see what happens.
Finally, in the minute that we have here, the GOP has made much about how much this is going to cost small business and how this would actually lead to people losing jobs rather than benefiting the millions who are without insurance. What do you think is going to happen with that piece of it?
Well, I think I think the judgment, the jury is still out on that at this point. I would say this about small business owners: they're certainly, Gary, concerned about this bill. They're concerned right now because they just have no clarity. I will also make a note here. This is important to note as we talk to small businesses every day. 1 in 4 small business owners, Gary, currently don't have health insurance. That's number one. Number two, 40% of those small business owners that have under 200 employees, they currently are in the situation not only where they are concerned about healthcare, they own their own individual policies, which means basically they don't have their employer-based plan currently now. I would suspect these business owners are going to actually go on to the exchange and see what's out there for them as well, Gary.
Aaron Smith, president of A.W. Smith, thank you so much for joining us.
You got it. Thanks for having me, Gary.
And you're watching Arise Exchange.